shortest questions I've been asked. How old am I? First thing, am I old enough to do this? Weird question that they've always asked me is, do I actually know what I'm doing? And do I really know why I'm doing what I'm doing? It's kind of important, but you do have to instill that level of trust and compassion with your patients so that way they can trust you overall. What do I love about my profession? What is there not to love about my profession? First, the ability to help people in a way that's profoundly unique to any other discipline and specialty of medicine and dentistry. Being the bridge between medicine and dentistry truly allows for us to be able to profoundly and I think just significantly impact the lives of our patients in a way that's more or less very unique and tailored to our skill set. Also, I think being a leader in our community gives us the strategic opportunity and the development to go ahead and allow for our communities to develop and grow and be, obviously, I think just a change of good and a force of good. Advice into becoming an oral maxillofacial surgeon. First, stay dedicated, stay focused. Don't listen to the haters. If you're passionate about what you're doing and why you're doing it, know your why, and then go for it. Be inquisitive and remember that you don't know everything. And when you realize that you don't know everything, that's when you can learn anything and everything. That's probably the biggest part. Stay humble. Yeah, so very common misconceptions about wisdom teeth are that all wisdom teeth need to be removed or all third molars need to be removed. Another misconception is that, and you see this very commonly in certain areas of the country, that people have to bone graft removing, bone graft in the site of a third molar, or they have to remove a third molar regardless of the age. Everything that we do surgically is patient specific, and it's tailored based on what the surgeon knows and that specifically what needs to be done. I think other misconceptions are that if you have your wisdom teeth, they don't need to be removed. And the sheer reality is that they can cause you more problems than they can good. So, prophylactic, preemptive evaluation, proper screening, and evaluation of those patients ahead of time allows us to have the best surgical outcome. The oldest patient I've had on a procedure was 106 years old. The second one was 105 years old. It was when I was in my maxillofacial surgery residency training at Harlem Hospital. It was an elderly African-American female. She was 106. And what I loved the most about it was actually not just the procedure, but it's the fact that she trusted me to do her procedure for her and just spending time connecting with her, asking her about her life, seeing what she had, what she didn't have, how life was like when she was a child, the changes that she that she saw, and the things that she saw that happened in our country and society. And another one of my patients was actually 105 years old, and it was when I was my first year out in private practice. Very unique, came to me obviously for a dental emergency, and just felt calm and comfortable with being treated. With the one that was 105, she had a large maxillofacial space infection. And the one that was 106, she actually needed to get just a tooth taken out. And then she needed to get an implant placed afterwards. And she wanted it. The sheer reality is that at the end of the day, dental implant rehabilitation doesn't necessarily have an age limit. One, you don't know how long. None of us know how long we're going to live. And if none of us know how long we're going to live, it doesn't mean that you can't place a dental implant onto a patient. Number two, at the end of the day, if the patient feels that they've been rehabilitated, and if you truly are rehabilitating them to their proper level of occlusion, their aesthetics, their functionality, there is a warrant behind to what they may need or they may have. And oddly enough, like she had a number 8. She had an immediate implant placed in tooth number 8. She wanted to have the tooth taken out and an immediate implant placed and then an immediate temporization because she had her great-granddaughter's wedding coming up. And so I said, yeah, it doesn't mean that like you have to have an old adjunctive therapy. You can do new therapies too.